Welcome to Healthy Aging with Annie.
Hello, friends. Welcome once again to another health talk. Today, I'm going to be talking about the link between perimenopause and an overreactive bladder. What causes it, the symptoms, treatment, and also home remedies that you can use to help yourself. Also, do not forget to subscribe to my YouTube channel so that you can always get notifications when I come online. Thank you. Now, what exactly is perimenopause? Perimenopause is the medical term for transition period before a person experiences menopause. That is perimenopause. Now, there are many symptoms associated with perimenopause, including an overreactive bladder. Now, there are a lot of other causes of overreactive bladder and a variety of treatment and management options. So it is not a death sentence. Do not be afraid. So I'll just give us the causes, the symptoms, and how you can manage overreactive bladder. Now, what are the symptoms of this overreactive bladder? Overreactive bladder has a lot of symptoms, and the symptoms can include: one, a strong and sudden urge to urinate immediately. That is one of the symptoms. The second symptom is being unable to hold urine long enough to get to the toilet. When you are not able to hold your urine, when you are pressed, before you get to the toilet, you see that your urine has started dropping. That is a symptom of an overreactive bladder. And then you need to urinate. The third symptom is that you need to urinate overnight. That is also another symptom of overreactive bladder. And then urinating more than 8 times in 24 hours. That is a symptom of overreactive bladder. And a lot of women during perimenopause experience this. Even menopause, they experience this. Now, so you may feel that another one is that you may feel that you might leak urine if you do not go to the bathroom immediately, or even though it might not happen. So sometimes some people feel that way also. So take note of it. There are good supplements that you can use and good medications that you can use to help yourself to take care of this situation. Now, what is the link? What exactly is the link between this overreactive bladder and menopause? Now, during perimenopause, a person's hormone levels during perimenopause, your hormone levels begin to change. Now, before this, high levels of the hormone estrogen help to keep the muscles around the bladder and pelvic organs strong. So, but due to these changes that occurs, you find out that the muscles, they are no longer, they are strong like they used to. And after menopause, the ovaries make very low levels of estrogen, and this dramatic drop can weaken the bladder and the urethra. So that is the link between the perimenopause and the overreactive bladder. So take note of this. Now, hormone changes can also lead to urinary tract infections, which can cause similar symptoms to overreactive bladder. And then people should always consult with their doctor when they notice or experience new urinary symptoms. Do not forget to discuss with your doctor, because according to the North American Menopause Society, low estrogen levels can cause the urethra and vaginal tissues to thin, the pelvic, and also the floor muscles can relax as a side effect of aging also. Now, this can lead to someone experiencing overreactive bladder and urinary incontinence. What are other causes? There are other causes. Perimenopause is not the only cause of overreactive bladder. Many things can cause a person to experience this overreactive bladder and other forms of urinary incontinence, and this can include one, childbirth. Many people can experience trauma during childbirth, and this can cause bladder symptoms such as overreactive bladder or urinary incontinence. Another cause is pregnancy. Yes, pregnancy. When someone is pregnant, when a woman is pregnant, their body goes through a number of physical changes, and due to this, when the baby pushes down on the bladder, urethra and pelvic floor muscles, it can lead to urinary urgency. So this is another cause of it. Hello, do not forget to subscribe to my YouTube channel, Healthy Aging with Annie, so that you can always get notifications when I come online. Another cause of this is that medications. There are some certain medications that can have the side effect of an overreactive bladder, and so that is why it's advisable that people should speak to a healthcare professional about the side effects of any medication they are taking. Another cause of it, is it the fifth or the sixth? The fifth or sixth cause of it is alcohol and caffeine. Now, both are diuretics and they encourage the body to make more urine, and this can also make someone to want to urinate more frequency. So you need to limit your intake of alcohol and caffeine, most especially if you're in your menopause or perimenopause. Then the next one is a nerve damage. Now, if someone has nerve damage, this can interfere with the signals from the bladder to the brain, causing the person to experience bladder issues. So take note of it. Then the seventh one is constipation. Now, if an individual experience chronic constipation, this can apply pressure to the bladder and cause the need to urinate. The next cause of it is, the eighth one is UTIs, that is urinary tract infection. Now, this can cause to develop overreactive bladder, irritation to the bladder, and it can cause someone to need to empty the bladder more frequently. So take note of these symptoms and try as best as possible to meet with your doctor whenever you go for checkup. Now, what are the possible treatments? We have prescription medications that you can use. Your doctor can prescribe some medications to you that can help to prevent persistent urge to urinate. The next one is that there are lots of medications. Just meet with your doctor. And then we have other medications like nerve stimulation. In this case, this can increase the blood flow and strengthen the bladder muscles. Then we have bladder retraining. Now, in this case, they will have to teach you how to retrain your bladder, and this involves not going to the toilet as soon as you feel the urge. Instead, you go at set times, whether you feel the urge or not, and gradually increase the time between toilet breaks. So take note of this. You can also help yourself to do Kegel exercises, pelvic floor exercises. This can also help you a lot. What are some of the home remedies that you can do? There are lots of treatment, lots of home remedies, lifestyle changes that you can adopt at home to help you to treat this overreactive bladder. One is the bladder control exercise. Just like I mentioned earlier, the Kegel exercises, that is the exercise to help to strengthen the pelvic floor by squeezing and holding the pelvic floor muscles. So this can also help. Then the second home treatment is that you need to avoid certain foods and drink. There are certain foods and drink that can irritate your bladder and cause you to want to urinate more frequently. So try and cut back on these items, and some of these includes your tea, coffee, citrus foods, tomatoes, spicy foods, soda drinks, chocolates and alcohol. So try and cut down on this, it will help you a lot. The fourth one is that you need to maintain a healthy body mass index. So carrying excess weight can cause pressure on the bladder, and this can make you to want to experience the overreactive bladder. So maintaining a moderate weight can help you to lower your risk of developing this overreactive bladder. So try as best as possible to manage your weight. Then the next home remedy is stream urination. Now what this means is that you need to, this involves going to the bathroom at set times of the day, whether you feel the urge or not. You need to set a time schedule for your bathroom for urinating, okay? And with time you'll be able to regain control over your bladder. The another home remedy is double voiding. Now in this case, you urinate. Now you can try waiting a few moments before trying again, and also to ensure that the bladder is completely emptied when you try to urinate. Another home remedy is delayed voiding. Now this is a practice of delaying urination for a while, even if you feel the urge to urinate, and this can build up from few minutes to several hours, and it is best for you to ask how to go about this method. Ask your doctor before you go about it. Do not forget to subscribe to my YouTube channel so that you can always get notifications from me whenever I go online. So now, should you drink plenty of water? Yes, drinking water is also very, very good. Take lots of clean water to maintain your good health. The fact that you have overreactive bladder should not stop you from drinking good water. It helps to cleanse the system from toxins and free radicals, and it's also very, very good, and it helps to keep the kidney and the bladder healthy. So try as best as possible to drink lots of water. It's very, very good. Overreactive bladder is a term that relates to control of the bladder. That's just the summary of all what I've been saying. And also, during menopause or perimenopause, estrogen levels reduce, which causes the structures around the pelvic organs to weaken, and this can cause someone to experience sudden urge to urinate and more frequent urination. So there are lots of multiple treatment, like I said earlier, that can help you to take care of this overreactive bladder. Lifestyle changes also is very, very key to take care of this overreactive bladder. It's not a death sentence, it is treatable, it's something that you can manage. Thank you very much, and do not forget to always subscribe to my YouTube channels so that whenever I come online, you can always get notification. Thank you, and see you again in my next class. Goodbye.